We lived in the hospital on the third floor, and we took our meals there, of course, and everything while we were in training. And then when we were graduated and working for the hospital, we could get some food at the cafeteria, or we could go out and do lunch or whatever we wanted. So while we were still in training, we were restricted to some extent. Like we had to get permission to go out late at night, and we did very little dating. They didn't encourage dating. We had some written exams and some oral, and we took the tests at ISU. And if we passed, which most of us did, we were then considered licensed nurses. We took care of people who were on low incomes, and we had a clinic 3 times a week for a half day, and we had a doctor in there, and we would see patients and prescribe medications, or the doctor did anyway. And then we also went out into the rural areas at times, and we did some work in the schools. And we would go, and if somebody called in and wanted a home visit, we would do that. There was this little man who had a little wagon and an old black horse, and he went around collecting junk, and he disappeared for a couple of days. The police kind of looked out after him, and when they hadn't seen him, they called me and asked me to go with them, to which I did. And he was living in a cellar, and he didn't even have any lights. The police had their heavy flashlights, and we found him huddled in a corner, so we called an ambulance. In those days, we used the funeral homes. We didn't have real ambulance service like we've got now. And we took him to the hospital. He was in deplorable condition, and he didn't make it. It was doing home health under the Medicare program. And I visited mostly elderly people, and once in a while a person on welfare, but mostly senior citizens, which was a pleasure because they were so nice, most of them anyway. For a while, I just didn't do anything. My husband and I would just take off some days and unexpectedly, so we didn't commit ourselves to very much. And then I started to go back to the hospital and volunteered there for 25 years, almost 25 years. But I got to the point where it was a bit much for me, so then I retired and I just stayed home. And we did some traveling, and I had a little dog, and I walked with him all the time. Well, I've had a great life. I'm Margaret Plastino. I'm almost 102 years, and I love being a nurse.